I'm thrilled to be here to talk about this topic today and to share the stage with Ashley. She and I work together at the Swedish OBGYN First Hill Clinic. I started with Swedish about a year ago in a clinical capacity as the medical director for menopause. I'm going to let Ashley introduce herself. Before I move beyond this slide, I just wanted to say that most of what we do is gynecologists, and most of what we'll talk about in this talk is about people with vaginas whose main hormone is estrogen, otherwise known as cis women. Some points in this talk do also apply to people with vaginas whose main hormone is testosterone, and occasionally also to trans women who've had surgery or bottom surgery. So where those things do come up, we will try to point that out and make that clear. The other thing I always like to start by saying is that one of the really wonderful things about the intake form in our clinic is that it not only asks someone their gender identity and their pronouns, but it also asks them if they're sexually active and with whom, what genders, whether that be one, the other, both, or all of the above, and it asks them what types of sex that they have, because those are very important factors that you need to actually know when making an evaluation for sexual pain and sexuality. Disclosures were up at the beginning. I do work 4.5 shares in a menopause-focused startup, and I write a textbook in OBGYN. However, neither of those really come into this talk. So I'm going to actually start out with the case. This is a woman who saw me within the last year. She is 65 years old. She's a G2, P2, had a history of 2 prior vaginal deliveries, uncomplicated. Her last menstrual period was about 10 years ago, maybe a little bit longer, after a period of irregular menses. She is married. She wishes that she desired sexual activity, but really feels like she does not. She has no significant medical or surgical history to speak of. She comes into my clinic with a complaint of no libido. She doesn't ever want to have intercourse. This lack of desire is very disturbing to her. It has a huge impact on her relationship, and I hear this word a lot. She tells me she feels broken. Her sister told her it's her menopause. She needs to come see me and get some testosterone or one of the new Viagra for women pills. So in taking a further history, it turns out that over the last 2 years ago, she started having increasing pain with penetration and a lot of just decreased sensitivity of her tissues in general, especially her clitoris. She was at first able to cope a bit using lubricants with intercourse, but this really stopped working altogether about a year ago. Even when she masturbates, she struggles to have an orgasm. She really doesn't have it with partnered intercourse anymore, and her desire has really fallen off since all this started. She also notes on questioning some increased itching at night, sometimes in the daytime, and she has been putting an over-the-counter lotion on her vulva in the daytime to try to manage some of this discomfort. She has no pain in her pelvis day to day as she's moving around. She has external and deep pain with penetration. So the primary source of her pain is the external vulva and the vestibule, which is the posterior part. However, she does also endorse some deep pain. She does not have day-to-day discharge. She notes that when they do attempt intercourse, she has a lot of bleeding and tearing of the tissues. And she actually also notes occasional bleeding and pain with bowel movement, which seems external to her and she assumed was hemorrhoids. She does not have any problems with incontinence. And so on the exam, you can see, this is her vulvar exam. There is some atrophy, or vulvovaginal atrophy, but there's also some significant loss of architecture. So this would be her clitoral hood. It's fused over her clitoral body. Her labia minora are basically gone bilaterally. On this side, you can still see just the remnant of one with a line of demarcation between that and the majora. You see white tissue around here. There's whiteness here. There's white here in the posterior perineum. There's also actually a fissure back here. And then this is her anal exam.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.